the Expert, sponsored by St. Elizabeth Healthcare.
A local man says a breakthrough device has made a huge difference in his life when it comes to managing diabetes.
Medical reporter Liz Bonas joins us now to explain how it works. Hi, Liz.
Hey, Megan, this device can help those with type 2 diabetes who need insulin but are hoping to avoid painful injections every day. The diabetes team at St. Elizabeth Healthcare says it's been on the market for a while, but new research now is showing us it might have incredible benefits that could add years to the life of a person with diabetes.
When you keep control as tight as you do.
He's the perfect patient with what he says is the perfect diabetes management device. So now Gary Volker says,
I like to get the word out to other people.
He wants to get the word out about what's called the V-Go.
So the V-Go is an insulin delivery device that's designed to give patients with type 2 diabetes a small amount of insulin that infuses all the time.
As this animation, courtesy of Valeritas, shows, unlike a diabetes pump, the V-Go works with no electronics, no batteries, no infusion sets, or programming. It is a lightweight pack you fill with insulin every day and wear for 24 hours. The idea behind this is to give you and your diabetes team one more tool to help you better manage your diabetes. This, however, one of the most advanced as we move into newer technologies. Volker showed us how he fills it with insulin and sticks it underneath his arm. A tiny needle, he says, he does not feel allows the V-Go to give him a steady dose of insulin. He can push a button on it if he needs a little bit more after eating.
It delivers 2 units of insulin for every press.
Putting this thing on is simple, and then when you push a button, and you're saying, is there a needle in me?
Without the V-Go, Volker would need multiple injections of insulin a day. Dr. Brad Eilerman is his endocrinologist who says,
And really it's a good option for anybody that has that requirement for multiple insulin shots.
What makes this remarkable, however, is that rather than just giving a person good averages of really high and really low blood sugars, this does something else. It allows doctors to do what they want to do most.
We want to keep it even all the time.
Dr. Eilerman says long-term research on keeping blood sugars within normal levels this way is still in the works.
But there have been some short-term studies, particularly in the inpatient area, where we show that when we're able to maintain even blood glucoses, people do better with regard to mortality and cardiovascular disease. So we think that that will likely expand to the long term.
November, of course, National Diabetes Month, and as always, we welcome your questions for providers at St. Elizabeth Healthcare. You can go to local12.com, click on Ask the Expert. So what's remarkable is you used to have devices that had a high here, a low here, and it would average. If this keeps them this way all the time, and really it's the diabetes complications that can take years off your life, if you could prevent those complications, you could extend lives by decades.
Now, is that device, do you throw it away each night, or do you keep it on for a certain, like a month or so?
So you keep it on for 24 hours.
Okay.
Then you toss that one, fill the next one. Yeah. It's a little pad that just sticks right behind the arm. Could really change the way we care for people as we're learning more about this disease.
Thank you, Liz.
All right.